My name is Lisa Greaney, and I am a consultant oral and maxillofacial surgeon. So I'm one of these people who are both a doctor and a dentist. And the reason why is because everything I do is centered around the face, the head, and the neck. And so the mouth and the teeth and the way the jaws meet is sort of integral to that. And because I've always had an interest in head and neck and face, that led me along the pathway to first of all become a dentist and then become a doctor. Oral and maxillofacial surgery, as I said, is all about the face, the head, and the neck. So for me in particular, not only have I always been fascinated by the head and neck, but when I was 16, I was fortunate enough to do some work experience in an oral and maxillofacial department. And I watched an operation by a renowned oral maxillofacial surgeon who has long since retired. And it was a cleft palate operation. And after the operation had finished, I realized that the patient was actually someone that I knew, and that had a profound impact on me. And so I wondered, how can I get involved in this? And I enjoy carpentry, I enjoy working with my hands, and particularly around the face. So I thought I could become a dentist. And I went and trained as a dentist. And throughout dentistry, I realized that I preferred the surgical aspect of dentistry, and things carried on from there. And the nice thing about oral and maxillofacial surgery for me is that I get to work with all of the face. So I get to work with the soft tissues of the face with my sort of skin cancer specialism, and I get to work with the hard tissues of the face, be it when people are born with a skeleton that is slightly different, or when people have had their skeleton moved in trauma and accidents and so forth. So I'm very lucky in that we get to deal with all aspects of that face. There's a lot of clockwork that goes on in this area. Seeing the change, the transformation of a patient from the start of that patient's journey to the end of the patient's journey. And I find it quite humbling that I get to play a role in that. And it's just fascinating, from somebody who has something on their skin that they're worried about as a cancer, and then at the end being free of that, or somebody who does not like the way, I don't know, something like the chin looks, but actually how their teeth meet together, and it has a profound an effect on, they won't go out to eat in restaurants, and then you see them at the end, and some people can be absolutely transformed, and it's just fabulous to see. It's a privileged position to be in. The ability to talk things through. I like to think that I can talk to people about anything and everything, so that everything is understood and that whole journey process is understood. And that is a two-way journey. Patients can approach me and tell me, where their fears are, what they want to achieve, and we need to work together completely to make that process happen. If I have to describe things in 5 different ways, that's part of my job. That's what we enjoy doing, but it's having that interaction with patients. I think that's completely invaluable. The only thing is healthy, handsome, happy, because I think those 3 things are very, very important. So yes, definitely healthy, of course. But for years, we have struggled so hard to get people's function back, to remove a cancer and make things work again, and completely forget the fact that our appearance is important. First impressions do count. And your face is that first thing you put forward and the first thing that people see. And so if you are confident also in the way you look, all of those things, health, handsomeness, helps. I'm not saying it's the be all and end all, but being confident about those things helps with happiness with oneself and well-being with oneself. And I think those three things are super important. So yeah, healthy, handsome, happy.